Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome back to another episode of Creative Caregiving and Beyond. And today we have a special guest, Claris Molina with LinkCare Companies. Welcome, Claris.
Thank you for having me, Wendy. So excited to be here.
I'm excited to have you here. And I've known you for a few years, and I tell you, you're just a master of all trades.
I so appreciate it. Thank you. It has been a few years that we met each other in private sector, long-term care setting.
Yes.
And ever since then, I mean, you're a rock star yourself. You know, when I first met you, I knew we needed to connect, but I thank you so much for acknowledging me.
Yes. Well, tell us about LinkCare Companies. Exactly what is under that umbrella?
Well, LinkCare Companies, let me take you back a little bit to see how it actually was established.
Okay, great.
I originally, my career trajectory changed completely when my father became disabled. He had a traumatic brain injury. I was in my early 20s, and I was working in a completely different industry. And through that process, I had to learn to navigate Medicaid, Social Security, the denials, the mountains of paperwork. And I just remember thinking to myself, if this is as complex as it is for me, I can just imagine what it's like for other families to kind of just navigate, especially that population of people.
Yes.
And so through that process, it led me to working for the state of Texas. I worked for Health and Human Services Commission. For several years, I was able to work on the inside, see how applications were processed, see how they're denied, see the ins and outs of the system. That led me to working in private sector. So I went from being a client to an eligibility caseworker, then working private sector to help patients and families that are in the same situation that my father was in at one point. And it's a joy for me because it's actually something that's really personal. So LinkCare, you know, you said LinkCare Companies, which is so true. We have a multitude of different services that we offer. And one of them is patient advocacy. And that's that navigating that patient from whether it's trying to get placed from the hospital to home or to the next care level, which is a nursing home, them trying to figure out eligibility. They may not have Medicaid. They might need to work with an attorney for asset protection. We have so many different connections. You're one of them that we will actually refer clients to that need asset protection, or if they just need support for an application or Social Security, they don't know what to do, we help them with that process. Another thing is we help with home health services. We help to get you that particular service that you need at home. It's just a lot of different things. Organizations also hire us for their Medicaid mitigation. Sometimes they have Medicaid pending dollars that they can't resolve. So we'll go in and we'll help their staff to kind of fine tune what's going on. What can they do to get those applications overturned? Maybe it's medical necessity that's holding it up and that was a miss. That's something that a lot of attorneys deal with. Even attorneys will use us sometimes because they're so caught up in doing the application, they'll need someone as an advocate to just kind of track the nursing home to make sure they're submitting their forms on time, their admission form on time that could hold up an application. So we have many facets to the business, and that's why it is LinkCare's company, because I have a different service for each different clientele.
That's awesome. So
Yes.
you're literally linking all those moving parts together.
Yeah. That was the idea behind the name, linking you to the care that you need. Absolutely. So that is what LinkCare is. It's connecting you to the care that you need and making sure that no one, whether it's an organization or a client, is lost in the gap. I saw so many times when I was, from a caseworker perspective, working for the state of Texas, where I could see so many people getting denied, not because they didn't qualify, but because they didn't know how to qualify. Gotcha. They didn't know how to navigate the policy. They didn't know how to find ways that could protect them in a way to keep, one, their assets, but also, you know, transition in a better position to nursing home or to that next level of care with the eligibility that they need. Yeah.
Well, wonderful. I know you've helped some of my clients too, and I appreciate that. And I definitely will be telling more people through this podcast, for instance, about your services, because it's much needed. And sometimes it's so overwhelming for the family because they're dealing with so much. Just having their loved one admit to a facility.
Absolutely.
And then to know about care plans, for example.
Absolutely.
and then to be able to attend those type of things. And,
right.
Yeah.
A lot of families, they go to these, like you said, it's overwhelming. It's a lot to understand what's going on from one moment to the next. Between change of condition, your loved one's life being turned upside down, you're now not only managing your life, but you're having to manage your loved one's life.
Right.
And so there's a lot of terminology that's thrown out, and sometimes, unfortunately, nursing homes or different care settings, they have this jargon that they use, and families just don't know how to navigate around it. They don't really know what a care plan is. They don't know what they should be asking, what they should be looking for. And that's something that we also do. We attend care plans on behalf of our clients to kind of help them, one, to prepare them for what questions to ask, to what to look for in reports to make sure their loved one's being cared for. We even have a nurse on staff that will actually go and take a look at clinical documentation. Yes. So, things from like diet change or recent falls, we look at that as well. So these are all different ways to better prepare you to be able to advocate for your loved one. A lot of times we are on some cases long term, but we like to empower our clients so that they know what to do in that next setting or in that next situation.
Okay, great.
Yes.
Well, that helps too, and then they can teach someone else as well.
Absolutely.
And it's a good cycle. So you guys are really in the nitty gritty of it all. You're right there. You've got your sleeves rolled up, and
we are on the field. A lot of times I have clients dropping stuff off at the office with some of my advocates that are there or the receptionist, but we are actually in the field a lot, coming to visit our families, coming to actually see the client. We have some clients that are out of state and they need us to go take a check, check in on their loved one and see how things are going. We'll do random room visits. So just really our services, especially with our patient advocacy, it is truly tailored to the needs that you have for your particular loved one. So we thoroughly enjoy it. We love what we do, and I think that's the passion behind it, which is why I also joined the APS board. I sit on the APS board in Dallas County as the educational director. Yes. And what we do there is we take a look at the most vulnerable population. A lot of times the people who are cycled through APS are people who are in a facility or in a care setting and then they left that care setting, or they're at home and it's difficult for them to make that decision to go to that next level of care. And it's just, how some things can be so overwhelming, you just don't know what decision to make. And you get kind of frozen. So we kind of take their hand and we're just like, okay, this is what we need to do. We partner with APS as well. So we work with APS to make sure, one, that client is empowered on their next phase of care. And then we help them with eligibility. We also help some caseworkers at APS with eligibility questions that they may have because they're coming in to make sure that person is, one, in a safe environment, but then they have that whole component of, do they have the right eligibility or Medicaid to even be in that next environment? So we help them through that process as well.
So do you also, it sounds like that works also for in-home care? For you guys to, help and undergird families that may be at home?
Absolutely.
Yeah, with Star Plus or with the...
Yes, we help with Star Plus Medicaid. We help with regular Medicaid, community Medicaid. If you need to get a care attended and you just don't know if you're eligible or not, we'll take a look at your assets to see if you're eligible. A lot of times people are going based off of an application they got denied 3 or 4 years ago. And we know COLA cost of living changes every year. And so you could be in a situation where you actually do qualify for Medicaid and you didn't know this whole time. So we empower our clients through knowledge and actual black and white policy. We pull it up for them, we show it to them, and we help guide and support them in submitting an application. And if there's a situation where there's assets that need to be protected, we're going to get them in touch with the right person to do that for them.
Okay, great. What about someone who doesn't know they're receiving like home health care, but they're not on Star Plus or anything like that? How would a family know that it's time to increase the care? They're in a routine and they're not in a hospital. I mean, is that something you guys can help assess? And make recommendations to families?
We have something called the next level of care assessment, where we'll come in and we'll request medical records from their doctor, their primary care physician. And we will also ask about recent changes in mom or dad or loved one's condition. Have they recently been forgetful? Have they fallen recently? Have they been hospitalized within the past 30 days? We take a look at what eligibility that they have, because they might be able to get some short-term therapy that will, one, allow that family some respite, so that they can get reacclimated and maybe get their home setting prepared to bring mom or dad back home. Or if it's going the long-term way and they need to go into a facility, we let them know about their skill days if they have that, so that they can get that intensive therapy and in that skill setting and be able to make a sound decision for, is it safe for them to come back home, or do they need to go ahead and stay in the facility long-term? But I feel like one thing we give them, we empower the client with, is knowledge, things that they wouldn't normally look at or they're not aware of, even coverages they're not aware that they have that they could use.
Well, that's true.
And that's including a PT, OT, ST at home, those different disciplines. You can actually sometimes get those therapies at home and you don't have to go to a facility.
Great.
Yeah.
Well, a lot of people need to know that, because that's a lot of, and most of our seniors would rather do it at home if they can.
Yeah.
And just to know that those things are available.
Yeah, a lot of clients who are actually getting that home health care piece, maybe they're getting cared by a loved one and they're only getting maybe 20 hours a week that has been honored for the insurance. And it's been like that for a couple of years. They're not aware that they can actually request an assessment. If you track the changes of condition, you can increase those hours. So you're not in a situation where you're using the bare minimum hours, and you truly, we all know, even though maybe you're getting paid 20 or 30 hours a week to care for your loved one, you're most likely doing more than that. So you can,
it's around the clock.
Absolutely.
No.
So I think, honestly, it's about painting that picture for the eligibility for the insurance, so that they understand what truly is going on at home. And we tell families how to track that so that they can, when they submit for new hours, they're able to truly get the amount that they're entitled to.
Really? So, and this is private insurance can do that too? Or is that just or Medicaid only?
Medicaid, private insurance, all of them.
Okay.
Whenever you are getting home health care, and we're talking about this specifically, you have an assessment when you originally start, and they're going based off of the condition at that moment.
Okay.
I can give you an example with my father. He had fallen down a few times using his scooter or just transferring from the couch to standing up and missed the wall, and he had a fall. And so that is actually an event. You track those events and then you report those to your insurance, and that's another way to empower yourself to have more hours, because it is requiring more time. It may have been easier for mom or dad to walk alone when they were ambulating and not falling, but now maybe they're falling, maybe they're having some balancing issues, or maybe they're just needing more time, more help getting dressed, or more reminders eating.
Yes.
Those are all things those are very key things that you can name whenever you're having your annual assessment, or even in between assessments, because they come normally annual or semi-annually to come visit. You can actually call in and say, hey, I feel like my loved one's having a change in condition and I'd like someone to come out and do an assessment. And a lot of times our clients will discover 15 to 20 more hours of care that they can earn a week just because of that.
Just because of that.
Yes.
Well, and those small changes can really mount up to big things.
Absolutely.
Even just eating solid foods to foods that have to be cut up or pureed.
Yeah,
even.
it changes.
I mean, that's a big difference.
It is. And it's a different way of approaching it. So, or even just getting additional support, like another aide to come in to help, so that you can again give that loved one respite time to go focus on themselves. Because as we know, I know you know, and I know, taking care of a loved one, it can be taxing on yourself as well, on your mental, and just trying to keep up with your own life at the same time. You're now managing a whole another person's life.
Yes, you are.
Yes.
Yes, you are. Yes, you are. And Clarice, I know in your career you've come across a lot of different families.
Yes.
In a lot of different settings, from the private sector to Health and Human Services experience, now APS.
Yes.
Are there any particular situations that stick out in your mind that made a impact on you, or you made a great impact on that family that you want to share with us?
Wow. Let me see who I can share recently. I can talk about a case that I have recently. This is one of my clients in a different city. I won't give too much information, but just a brief synopsis of what they're dealing with. This is a client who every day she, works in a warehouse. She was fine, late 40s, doing fine, no signs of health conditions changing, and had a stroke. Out of nowhere, had a stroke on her way to work. And through this change, she only had her Blue Cross Blue Shield Medicaid, or not Medicaid, private insurance through her employer. Because of her condition, it did cause her to get some other diagnoses, and it caused her to be in the nursing home longer than she expected. Her private insurance only covered 20 days. Sister, very young as well, was concerned about what's going to happen to my sister next. They're giving her a discharge letter. They reached out to us. They hired us as an advocate. We were able, one, to go back and take a look at the medical records to see why they're only giving 20 days. We discovered that she had 60 days. The nursing home had made a mistake.
Wow.
They couldn't discharge her. We were able to expand that time. We were able to appeal those cases and get her to have more time there. And also, they had stopped giving her OT because they assumed that she had exhausted her days. Well, by us advocating for her, reaching out to the insurance, they were able to extend her time. She went from being bedridden to now she's ambulating over 40 feet. She's able to get out of the bed alone. And yes, and now she's in a different nursing home. We moved her to a different nursing home where she's getting more intensive care, and she's also getting all 3 disciplines. So, and through that process, we're also helping her to apply for Social Security. So a couple of things that I feel like in my experience that make this so important is because had she not worked with an advocate, she would be at home wasting away, or she would have been misinformed. And that's why a lot of times our clients just don't know what's available to them. And so I feel like we were able to change. I've seen many cases like hers go in a different direction, where they were sent home and a loved one was just, taking off of work or lost a job, just trying to care for their loved one. And so I was very thankful to, one, be able to step into that life and make a difference for them. They were so thankful, and she's so thankful that she's making progress. She's not 100%, but she's better than where she was. And I feel like we had a lot to do with that. The fact that we're helping her to apply for Social Security, and they don't have to worry about, okay, well, what does this form mean? We can talk them through that form.
Exactly.
We really take it and we break it apart to make it more palatable for our clients.
Yes.
And it's not that big of an overtaking. They feel like it's something they can achieve. So I was thankful about helping with them recently, and I'm glad that she's getting the support she needs, and that she has hope that she'll be able to possibly go home one day and improve. Again, she's not all the way 100%, but she's definitely not where she was.
Well, and that's a huge difference between quality of life.
Oh yeah.
I mean, receiving that therapy, and then and there's so many times, and I come across this with a lot of my clients, and I've had this experience with my mom, where the therapy is interrupted because of insurance, and you do have to have an advocate, and it's so great that you guys are doing that, because they could be making strides, and then all of a sudden it cuts off.
Right, and it can be cut off, not even because it's exhausted. It could be something that, to be quite honest, that the therapist typed wrong.
Right.
I don't know how many times we've gone through, and when I'm attending a care plan for a client, we're hearing one thing, but what's reflected on the documentation is something completely different. Well, of course, the insurance is going to go based off of what they're reading. And so if you're telling us that they're making strides, but your paperwork shows that they're stagnant, we're going to have conflicting information, and we're most likely going to get denied and have to go through an appeal. And so, yes, empowering your clients to go through and read medical records, keep track of progress weekly, especially if they're in a nursing home or if they're in a outpatient setting. Even when my father was doing outpatient setting through Medicaid, they would only give him 4 weeks, and I had to learn to, okay, well, why are they only giving him 4 weeks? What's missing? He's trying his best. I know he's participating. Let me take a look at the medical records. And it dawned on me, they weren't capturing everything. And that is where you find out if your authorization is going to be extended or denied. That's a lot of where the truth lies.
Right in the medical records.
Right there, yes.
Yeah. But then also knowing how to read it.
Right. and
understand and navigate those medical records. So you guys are
and we have
a great asset.
We have an MDS clinical nurse, and she's familiar with that. They understand the MDS settings, the codes that are used in those different settings, and what the language that the insurance speaks, so that we can understand how to fight for our client when it comes to an appeal. Yeah.
Well, if a family wanted to get in contact with you guys, because I'm definitely going to be sending some more families your way too.
Thank you.
Because you guys have been a great help for us.
I appreciate it.
And you guys, these small things like that, they're big things. Just even having time to deal with insurance companies.
Yes. Yeah.
It takes several hours out of your day, just to make the calls and try to get to the right person. And you guys already know the shortcuts on that and how to do it.
Well, we are located in Garland, Texas. We have an office. You
Okay.
can go to our website, which is mylinkcare.com.
Okay.
You can call us at 469-935-4111.
Okay.
And we'll be able to help you make an appointment. We have a free 30-minute assessment just to kind of understand what's going on, tell us a little bit more about your situation. We don't only just help clients, patients, but we also help organizations. I have a few very important clients. One is a dialysis company, a couple of nursing homes, long-term care, where they're needing help with navigating their Medicaid pending dollars.
Yes.
I also have helped some attorneys who they just can't trail their clients. They're having issues with the nursing home doing their part. It's holding up their Medicaid application with the MDS. They don't have medical necessity, or they just don't have the client sitting in place for at least 30 days to get that eligibility. They're bouncing around. So different things. So we have a portfolio of different clients that we can help, whether it's a corporation, because I do consulting for corporations, or all the way down to a patient advocate, helping them to just kind of navigate all of the complexities of Medicaid and Social Security. We're there for them.
That's awesome. Companies and individuals need your help.
Yes.
For sure.
And that's what we do. We step in and we try to make whatever the situation is as least complex as possible. That's what we try to smooth it out for them.
Great. Well, that's great. Well, thank you for coming on.
Thank you for having me, Wendy. It was a pleasure.
I'm thinking about somebody right now I'm going to talk to you after the show about that I need to run by you and make sure this family is taken care of.
Thank you.
They're having some challenges.
Absolutely.
That's wonderful, Claris. And thank you for your commitment.
Thank you.
I mean, you're all in. You're all in the elder care sector. We need more people like you.
I thoroughly enjoy it. It doesn't. It definitely doesn't feel like work for me. When I was working for companies, people would always come to me for advice, and it just felt like something I needed to do. And so now I get to wake up every day and do it, helping people, and it's a joy. It's definitely
you're
something
natural
I enjoy.
at it. This is your calling for sure.
Thank you.
This is your calling. Well, thank you so much for tuning in to Creative Caregiving and Beyond, another segment. And Claris, Molina, and LinkCare Companies has been invaluable in helping a lot of people in their community and around the country. I mean, so don't hesitate to give them a call and use their services. And we love you tuning in today. Don't forget to like us and subscribe to our channel. And we'll be looking forward to seeing you next time.